TB related labs, we've talked about these a little bit already, but there's three fundamental lab techniques for TB detection. One is an acid-fast bacilli smear, one is the cultivation of the organism or culture, and one is organism speciation or a DNA probe or RNA amplification. The most useful body fluid for analysis would be sputum because it's a respiratory infection. But if you identify Mycobacterium tuberculosis in any body fluid or any tissue, it would be a diagnostic of active TB, since active growth always will produce disease. So if you were going to do a sputum sample and culture, the stain that they would use is an acid-fast stain because our Mycobacterium tuberculosis that causes TB does not stain well under gram stain. So patients that have a persistent or productive cough over 3 weeks with anorexia or unexpected weight loss, night sweats and fever, hemoptysis, chest pain, fatigue, or any high-risk patient, you could consider reaching for a sputum culture with potentially an acid-fast stain to diagnose TB. This is what acid-fast staining looks like. It kind of looks pink or red under light microscopy. And the acid-fast stain drives the stain into a lipid-rich cell wall, as the cell wall is gram stain resistant. And oftentimes you're collecting 3 morning sputums with the goal of greater than 5 mils per sputum on consecutive days. And then this test is performed within 24 hours of collection. It's much more rapid, but it's less sensitive than culture, and it can detect a decent amount of organisms per mil of fluid. But a negative smear does not rule out disease because there could be a small infection present. A positive smear can indicate TB, but it doesn't confirm a TB diagnosis, as some stains are not actually Mycobacterium tuberculosis. It doesn't say this is tuberculosis, it just says this is a bacteria that acid fast stains. From there, you want to monitor treatment, and you should see that the stain should be negative about 2 months into antimicrobial therapy. PCR DNA probe takes about 36 to 48 hours, and it's utilized on a sputum culture sample. You also can do an MTD direct test, a gen probe, which was approved over like 30 years ago. It takes 5 to 6 hours. It uses ribosomal RNA. It has amplification techniques with enzymes, 1 billion-fold replication, and chemiluminescent labs. And the sensitivity and specificity is pretty high, but it is a harder test to obtain, and a little bit more expensive. Ultimately, a culture is the gold standard for confirming TB diagnosis. You culture all specimens, even if the smear or the NAA test is negative, and you would result this in 4 to 14 days when liquid medium systems are used. You would culture also monthly until conversion, and your goal is 2 consecutive negative cultures. Important to note, this is diagnostic for TB, not screening for TB, like we'd use the PPD test or the quantiferin gold test.